Come on in.
Jones, I got your meds for you.
Oh, okay.
Let me pull this curtain. How you doing today?
Well, got this tube in me, but other than that, I'm okay.
What's your name and date of birth? You know
Jim
the drill.
Jones, 7/19/1940.
Any allergies?
Nope, don't have any, except bananas.
Good deal. Okay, I'm gonna swing this home. Well, I'm gonna give your meds here by your PEG tube.
Oh, okay.
Your feeding tube. I'm gonna stop your tube feeding for now. So I'm gonna turn that stopcock away. First thing I'm gonna do is,
What's that tube? What is that stopping?
that stops the tube feeding from going into your stomach right now. Because right
Okay.
now I'm gonna see how you're doing, how you're digesting it.
Okay.
So I brought in this this kit here, a piston irrigation tray, and luckily there's markings on the side of the box, so I can just squirt it in here and see how much is left, if there is some. Okay?
In my belly, you mean?
Yep, in your
Oh,
belly.
okay.
Let me set that down there for a second. I'm gonna put a towel here so that I don't make a mess underneath. Oh yeah. Okay. Let me listen to your belly while I'm down here. Yep. Good bowel sounds. Let me raise your head a little bit. Good. I don't have to bend over so far. Listen to your lungs too while you're here. Make sure they're still clear.
How do I
Very
sound?
Good clear lungs. Okay, when
Okay.
you're on tube feedings, you want to always check that. Make sure you're not getting pneumonia. Okay. All right. So, tube feeding looks good. Dressing looks dry. I am going to attach my syringe and see how you're doing with your digestion. Okay, so no residual really, which means everything that we're giving you, you're digesting. It's going through. If you had a lot, I would put it in this tray and measure it, okay? So we could let the doctor know that things weren't moving through as fast as he's putting them in. Okay, so I know that I don't have a lot in there and you're digesting it. So now I'm going to irrigate it. Again, turn it off to the feeding, on to the patient, and I'm going to irrigate with 30 cc's of water. And I'm just going to let it go in by gravity, and it should go in okay. There you go. All right, and then my first medication, and of course I would have done my 3 checks, checked the MAR, checked the dosage. The point here is that we're doing it by gravity. After the med, you're going to flush again with 15 milliliters of water to flush that med through. This is my second med, my crushed med, and you'll see why. I'm not going to put it all in, guys, because it's got a lot of chunks. They don't dissolve real well in a lab setting. And then my final administration is a final 30 milliliter flush. Sorry, I guess I'm showing my age. And that should, again, just flow in with gravity. All right. Then you turn that back so that the tube fitting will now flow. Cap back on. If you made a mess, clean it up. Cover the patient back up. How's that, Mr. Jones? Okay?
Well, I feel like I got a full belly.
Feel full? Good deal. It looks like it's doing its job. It's moving through. I am going to go document these medications. Do you have any questions for me? Nothing?
No, I don't think so.
No? Do you, let's see, here's your phone. Got your possessions.
Yeah, you know I like my phone.
Yeah. You got your call bell. I'm going to put your bed back down. I like to keep your head up still at about 30 degrees because I just put some more stuff in your belly and I don't want you to choke on that or have you run the risk of pneumonia. Are you having any pain at all?
No, I'm good.
Good. And do you need to use the restroom? Do you need to go potty at all?
No, I'm good.
Okay. And you're in a good position?
Mm-hmm.
Like I said, I want to keep your head up, but other than that, you're
Why do you want to
happy.
keep my head up?
Well, when you have liquid in your belly and if you're lying flat, sometimes it'll float up and could get into your lungs and cause pneumonia when you're in bed a lot. And I don't want that to happen. I want to keep your head up.
Okay.
All right, well, if you don't need me, then I am going to go document these medications.
Okay.
All right?
I'll see you next
And
time.
I will see you in about an hour. Do you want me to leave this curtain drawn, or do you want that back open?
You can leave it open. I'll just
Okay.
see everybody
I'll leave
then.
that open, and then I will.
Yeah.
I'll see you in about an hour.
Okay. By the way, what are you going to document?
Okay, I'm going to document how the patient tolerated it, how much residual I had, which was about 3 cc's, and I just refed that. And then I'm going to document my intake, which would be 30, 60, 70, 85, 100. So 100 cc's of fluid went in, and that's it. And that he had good bowel sounds, that his lungs were clear, tolerated procedure well.